Today, I want to talk about oral diabetic medications in simple, easy to understand language. We're going to focus on tablets used to treat type 2 diabetes, what they do, the common side effects, and what doctors monitor for blood work. My name is Dr. Heather Douglas, PharmD. Diabetes is a growing public health epidemic and it affects millions of people worldwide. Type 2 diabetes is especially common in African American, Hispanic, and older adult populations. Now, what is type 2 diabetes? It's a condition where blood sugar stays too high. This happens either because the body doesn't make enough insulin or the insulin it does make is not used properly. Now, insulin is a hormone that helps to move the sugar from the blood into the cells for energy. Now, when the sugar stays in the bloodstream, it can damage the blood vessels and nerves, and this increases the risk for heart disease, for kidney disease, for vision problems, and nerve pain. Now, we always think diabetes is what's called a sugar disease, but it's not caused by eating sugar alone. It develops from a combination of issues from family history, insulin resistance, being overweight, poor diet, lack of physical activity, and also getting older. Now, type 2 diabetes is what is called a chronic condition. There's no cure for it, but it can be controlled with lifestyle changes and with medication. We have seen persons stop taking diabetic meds and after dramatic weight loss and healthy eating combined. So the goal of diabetes medication is to lower the blood sugar and to prevent complications that I've mentioned before. Now the drugs used, we're going to go over a few of them. Drug of choice is metformin. The brand name is called Glucophage or Glucophage XR, which stands for extended release. Now metformin is what is used first for persons with type 2 diabetes. How does it work? It works by decreasing how much sugar the liver makes. It helps the body use the insulin better, and it also slightly reduces the sugar that's absorbed from the foods that you eat. What are the benefits of metformin? Number one, it lowers the blood sugar. It usually does not cause weight gain, and there's a low risk of getting hypoglycemia or low blood sugar. Let's look at some of the common side effects of metformin. It's nausea, diarrhea, stomach upset, and gas. Now, these side effects usually improve over time or if you take it with food. The usual dose for metformin is 500 milligrams twice a day, and the maximum is 2,000 milligrams every day in divided doses. What's the concern? Lactic acidosis, very rare, but is usually fatal. Doctors will monitor the kidney function and your A1C while on metformin. Another class of drug is the sulfonylureas. This is glucotrol, the brand name or glipizide, and diabeta or glyburide. Now, these medications work by letting the pancreas know to release insulin more in the body. What are the side effects of sulfonylureas? Low blood sugar and weight gain. Another class of drug is DPP-4 inhibitors. These is Januvia, Trajenta, Onglyza. The usual dose of these is one every day up to maximum 2 times a day. And these help to increase insulin and decrease the sugar release after eating a meal. The side effects for these medications, headache and stuffy nose are the most common side effects. SGLT2 inhibitors, this is Jardiance, Farxiga, Invokana, and these drugs help to remove excess sugar through the urine, which means that frequent urination, frequent trips to the bathroom. Side effects include yeast infections, UTIs, and dehydration. Actos is another class of drugs called TZDs. There used to be a drug called Avandia, but that was discontinued. This helps the body use insulin better. Side effects of the TZDs are weight gain, swelling, and in some patients, heart failure risk. So doctors monitor these patients very aggressively. What are the labs that doctors use? A1C, fasting glucose, kidney function, and sometimes liver tests. Now, just so you know, A1C tests are available over the counter, so you as a patient can go to CVS Walgreens, any other pharmacies, and get an A1C test. So apart from medication, there are lifestyle changes, which include healthy eating, exercise, weight control, and hydration. This makes the medications work better. So when we talk about healthy eating, it means eating more fruits and vegetables, eating more omega-3s, more salmon, more sardine, not eating as much meat. Exercise will help to regulate the body for you to lose weight so you can get within that normal range. Weight control, hydration, lots of fluids also let you feel fuller a lot quicker so that you eat less. So lifestyle changes will help with diabetic concerns, and if you are diabetic, these can help you to get off your medication quicker. So can we have a summary now of all that we have spoken about previously? Oral diabetic medications help to control blood sugar and reduce complications. The right medication could be right for one person but not right for another, so it's all patient specific. Never stop or change diabetic medication without talking to your doctor or your pharmacist first. As always, this video is for educational purposes only and not to be taken as medical advice. Please see your primary care physician or your pharmacist for your personal medical advice. Follow along for more trusted medication education. If you have any concerns or if you'd like me to discuss any other topics, please leave it in the comment section below. As always, be healthy.